Okay, here we go again. This is Miss Howell, and we're going to work on Module 6A, starting the chapter for muscle system, specifically the skeletal muscle system, and we're going to do an overview, or part of that overview today. This picture looks a little bit like one in your textbook, and so what I need you to do, if you notice the star in the top left corner, is to find this picture in your textbook and spend some time on it like you did memorizing the bones of the body, because you need to know these major muscle groups in the body as well. All right, again, just like always, we want you to remember to look for terms that are written in red as I speak, and those red words will be what you fill in the blank on your printed study guide. And look for stars throughout the presentation. They could either be a red star or the little black asterisk next to terms or statements in the slides. All right, so there are three types of muscles. Though we're going to focus on the skeletal system today, I need you to remember that there are three different types of muscles, and those are the cardiac, the smooth, and skeletal muscles. Back in Module 4B, we talked a lot about the different terms that we use for motion and positioning, and we're going to use these terms a lot in this new module. So you might want to go back and refresh your memory if you've forgotten some of those terms, like adductors and abductors and prone and supine and those types of words. The human body has about 640 skeletal muscles. Thankfully, we're only going to focus on a small percentage of them. Some general terms you need to know before we begin. The origin is the point at which a muscle's tendon attaches to the more stationary bone. You can look at the picture on the right. The insertion is the point at which a muscle's tendon attaches to the movable bone. And the belly. The belly is the largest part of the muscle, which actually contains all the muscle cells. The most important thing to remember about muscle action is that muscles never work individually. They always work in groups of two or more. Consider your forearm. Which muscle works to flex your arm? It's the biceps. So then which muscle opposes this action and extends the arm? That would be your triceps muscle. Remember that muscles don't extend themselves. They only contract and relax. To extend, an opposing muscle has to contract. At times, there are multiple groups of muscles that work together to synchronize movement in the same direction. When muscles work together to create the same motion, they are called synergists. If one muscle is more important than another in creating movement, it's called the prime mover. We'll look at one of those in a few minutes. When a muscle works opposite of another, as in flexion versus extension of the biceps and the triceps, we call this an antagonist. Notice there's a star by that one, so you'll need to know that for the test. Muscles tend to work as levers. Since muscles only contract, they do not push. They always pull. Levers consist of a rigid bar that rotates around a fixed point called a fulcrum. An effort is the force that, when applied, moves a weight or a resistance. So you've got an F for fulcrum, E for effort, and R for resistance. There are three types of levers in the world or in the study, and they're also the same in the human body. And it all has to do with the order of those three things: the resistance, the fulcrum, and the effort. So if you look at those pictures, the first class lever has the resistance with the fulcrum in the center and the effort applied on the other side, like a seesaw. The second one is fulcrum on the end with a resistance, and then the effort is lifted or pushed. And the third class lever is the fulcrum, where effort is applied and the resistance is lifted. So those are the three different types of levers, and our body works in the same way. Now, there are 7 criteria for how muscles have gotten their names over time. The first one is the size of the muscle. For example, we have the gluteus maximus and the gluteus minimus. We also have muscle shape. The deltoid and the trapezius are named because of the shape of those muscles. They look like a delta, which is a triangle, or a trapezius is like a trapezoid. The third criteria is location of the muscle. Tibialis anterior. Anterior means the front, so that's how that muscle got its name. Also, number 4, the orientation of the muscle fascicles. We have the abdominis rectus, or the obliques. Rectus goes up and down, and obliques are an oblique angle, so kind of a side to side, high to low kind of angle. Number 5, the muscle origin and insertion. And this one has 3 parts, the sternocleidomastoid. We'll look at that one in class. Number 6, the number of heads or origins of the muscle. So the biceps has 2, the triceps has 3. And also the muscle's function or action. Thigh adductors would be the muscle in the thigh that pulls the leg back toward the midline, because its adduction is that positioning. So the sternocleidomastoid muscle is the prime mover of the head. It's found on both sides of the neck, and contraction of one side will rotate your chin toward the opposite side. Contraction of both sets together, and that brings your chin down closer to your chest. The occipitofrontalis raises your eyebrows, and it wrinkles your forehead. Winking your eye is accomplished with a circular muscle called the orbicularis oculi. So orbicularis means it goes in a circle, an orbit, and the oculi refers to the eye. So it's a circular muscle that helps you wink your eye. Your left and right buccinators are your cheek muscles. Smiling requires the use of 2 muscles, the zygomaticus major and the zygomaticus minor. Frowning only needs 1 muscle. That's the platysma that pulls the corners of your mouth down. You use your orbicularis oris to purse your lips. Remember, we said orbicularis meant like an orbit. It goes in a circle, so it's a circular muscle around your mouth, the oris, your oral cavity, and that purses your lips. And here's another star on this one you need to note. The buccinators, which were your cheek muscles, and the orbicularis oris, that circular muscle around your mouth, are also sometimes called your kissing muscles. Chewing, or the name is officially called mastication, requires multiple muscles. So to chew your food, you need your temporalis, your masseter, your lateral pterygoid, and your medial pterygoid. All these muscles work together so that you're able to chew your food. And that's all we're going to do today. So you've got less than 10 minutes of notes today. We'll stop here, and the next time I do a video for you, it'll be the major muscles of your trunk, your pectoral and pelvic girdles. So your upper body, lower body, and trunk. If you have any questions about any of these, bring them to class, and we will talk about them there. Have a great day.